Alcohol intoxication, commonly known as drunkenness, is a physiological condition. It results directly from the consumption of alcohol. This state leads to a noticeable impairment of cognitive functions. Motor functions are also significantly affected during alcohol intoxication. Alcohol absorption is initiated in the stomach and small intestine. Due to its water-soluble nature, alcohol rapidly enters the bloodstream. The absorption process occurs quickly after ingestion. The stomach and small intestine are primary sites for this absorption. This rapid absorption is due to alcohol's ability to dissolve in water. Once alcohol enters the bloodstream, it begins to distribute throughout the body. The distribution affects organs and tissues based on their water content. Organs with higher water content receive a proportionally larger concentration of alcohol. This differential distribution leads to varying effects on different parts of the body. The liver is the primary site for alcohol metabolism in the body. Alcohol metabolism primarily involves enzymes such as alcohol dehydrogenase, ADH. ADH converts alcohol into acetaldehyde, a toxic intermediate compound. Acetaldehyde is further processed by aldehyde dehydrogenase, ALDH, into acetic acid. Acetaldehyde is a toxic intermediate product formed during alcohol metabolism. It is a significant contributor to the immediate adverse effects of alcohol intoxication. These negative effects include symptoms such as nausea. Acetaldehyde also contributes to the experience of headaches after alcohol consumption. Therefore, acetaldehyde toxicity is a key factor in alcohol-induced discomfort. Alcohol impacts the central nervous system by reducing neuronal activity. This depression primarily occurs through interaction with GABA receptors. GABA receptors are crucial inhibitory neurotransmitter receptors in the brain. Alcohol's interaction with GABA receptors enhances their inhibitory effect. This enhancement results in sedative and anxiolytic effects, reducing anxiety and promoting relaxation. Alcohol consumption can significantly impair cognitive functions. These impairments affect critical abilities like judgment and decision-making. Alcohol disrupts the normal processes of memory formation. This disruption occurs due to alcohol's interference with brain activity. The brain's neural pathways are negatively impacted by alcohol's presence. Ultimately, cognitive skills are diminished under the influence of alcohol. Alcohol consumption negatively affects motor skills. This impairment is primarily due to alcohol's influence on the cerebellum. The cerebellum is crucial for coordinating movement and maintaining balance. Alcohol-induced cerebellar dysfunction results in reduced coordination, impaired balance, and slower reaction times. Alcohol intoxication manifests through various physical symptoms. Slurred speech is a common indicator of intoxication due to impaired motor control. Blurred vision can occur as alcohol affects the central nervous system. Flushed skin may be observed due to vasodilation caused by alcohol consumption. Decreased body temperature is another potential symptom of alcohol intoxication. Blood alcohol concentration, BAC, is a key indicator of alcohol intoxication. BAC levels directly correlate with the degree of impairment. Low BAC levels typically result in mild impairment. High BAC levels can lead to severe impairment, potentially resulting in a coma. Several factors influence the rate and extent of alcohol intoxication. Body weight is a significant factor affecting alcohol concentration. Generally, individuals with lower body weight may experience faster intoxication. Gender also plays a role in alcohol metabolism. Females typically have a higher percentage of body fat and lower water content compared to males. This difference can lead to higher blood alcohol concentrations in females after consuming the same amount of alcohol as males. Consuming food before or during alcohol intake affects the body's absorption process. Food consumption slows down the rate at which alcohol is absorbed into the bloodstream. This slower absorption leads to a reduction in the peak blood alcohol concentration, BAC, level. The presence of food in the stomach effectively dilutes the alcohol. Certain medications can interact negatively with alcohol. This interaction can amplify the effects of alcohol. Adverse reactions may occur due to these interactions. These reactions can lead to dangerous health consequences. It is important to understand these risks when taking medication. Regular alcohol consumption can lead to the development of tolerance. Tolerance means the body requires more alcohol to achieve the same effects. This increased consumption is needed to reach the desired level of intoxication. As tolerance grows, individuals may unknowingly increase their alcohol intake. This escalating consumption significantly raises the risk of alcohol dependence. Driving under the influence, DUI, and driving while intoxicated, DWI, are illegal. These laws prohibit operating a vehicle while impaired by alcohol or drugs. A key factor is exceeding the legal blood alcohol content, BAC, limit. The specific BAC limit varies depending on the jurisdiction. Consequences for violating DUI, DWI laws can include fines, license, suspension, or imprisonment. DUI, DWI convictions result in several legal and administrative penalties. Financial penalties include substantial fines levied by the court. Driving privileges may be suspended. Restricting mobility. Mandatory alcohol education programs are often required for rehabilitation. First aid for alcohol intoxication focuses on immediate life-saving measures. The first priority is to ensure the intoxicated person has a clear airway. Positioning the person correctly can help prevent choking, especially if vomiting occurs. Continuously monitor vital signs such as breathing and pulse rate. Stay with the person and provide reassurance while waiting for medical assistance. Do not leave the person unattended until professional medical help arrives. Immediate medical assistance is crucial in certain emergency situations. If a person is unresponsive, it indicates a potentially life-threatening condition. Difficulty breathing requires immediate medical intervention to ensure adequate oxygen supply. Signs of alcohol poisoning also necessitate immediate medical attention. Prompt medical intervention can significantly improve outcomes in these critical situations. Alcohol poisoning presents a range of severe health risks. Respiratory depression is a critical complication, hindering oxygen intake. Alcohol poisoning can induce a coma, resulting in a prolonged state of unconsciousness. Brain damage is another potential consequence, leading to long-term neurological impairment. In the most severe cases, alcohol poisoning can be fatal. Immediate medical intervention is crucial to mitigate these life-threatening risks. Chronic alcohol abuse poses significant long-term health risks. One major risk is liver damage, potentially leading to cirrhosis. Cardiovascular disease is another serious consequence of prolonged alcohol consumption. Neurological disorders can also arise from chronic alcohol abuse. The risk of developing certain cancers is elevated with long-term alcohol abuse. Alcohol consumption can worsen pre-existing mental health conditions. Conditions like depression and anxiety are particularly susceptible to exacerbation by alcohol. Alcohol can also reduce the effectiveness of psychiatric medications. This interference can complicate treatment and recovery from mental health disorders. Responsible drinking involves employing strategies to minimize negative effects. One key strategy is setting limits on the number of drinks consumed. Pacing consumption by spacing drinks out over time is also important. Staying hydrated by drinking water helps to mitigate the effects of alcohol. Avoiding drinking games can prevent rapid and excessive alcohol intake. These strategies promote moderation and reduce the risk of alcohol-related harm. Designated drivers prevent impaired driving. Using designated drivers reduces the risk of accidents. Alternative transportation methods also help prevent impaired driving. Choosing a designated driver is a responsible decision. Identifying signs of alcohol dependence is essential for timely intervention. Withdrawal symptoms are a key indicator of physical dependence on alcohol. Compulsive alcohol-seeking behavior suggests a psychological dependence. Early recognition of these signs enables prompt access to treatment. Effective treatment can mitigate the harmful effects of alcohol dependence. Various resources are available to aid individuals in overcoming alcohol abuse. Counseling provides therapeutic support and guidance for individuals struggling with alcohol abuse. Support groups offer a community environment for sharing experiences and encouragement. Medical interventions can assist in managing withdrawal symptoms and preventing relapse.